Thank you very much, Professor Azad. So now we're going to proceed to session 2. We're going to really get started now. Session 2, the collaborative, facilitating global monitoring, learning, and accountability. And I would very much like, I would request Mr. Binod Mahanty from GIZ to please come up, and he will introduce the speakers and moderate the next session.
Yeah, good morning, everyone. My name is Binod Mahanty. I work with the German development organization GIZ, and I'm representing the German Ministry of Economic Cooperation and Development at this conference. I have the honor of chairing and moderating this important session entitled The Collaborative Facilitating Global Monitoring, Learning, and Accountability. Can I have the second slide? With the global perspective of our work and the perspective of key partner organizations in this collaborative. And also we'll hear from external organization, CSO and external organization, which is not part of the collaborative, but which can give feedback on the work of the collaborative. So can I ask my colleagues to come up on the stage, please? So let me introduce to you today Kathleen Handley from USAID in Washington. She's going to give the overview presentation on behalf of the collaborative. Then we have Alastair Robb from WHO in Geneva, and Sam Mills from the World Bank in Washington. Both organizations are members of the Health Data Collaborative, and we also have Shams Arifeen from icddr, who will give the perspective of an external CSO. So, and after the presentations, we'll open the floor for discussions and questions from the floor. So I look forward to an exciting session and ask Kathleen to please present on behalf of the PhDs.
So, good morning, everyone. I cannot begin without mentioning the tragedy of yesterday. On behalf of the USAID family, we're very saddened at the loss of our colleague, Zuhaz Manam, and his friend, Mahbub Chinoy. We are in mourning, but the important work that we are doing will carry on. So, on behalf of the Health Data Collaborative, I'd like to thank Professor Azad and the government of Bangladesh for hosting us, and for your steadfast leadership and continued commitment to strengthening health information systems in Bangladesh and throughout Asia. We're pleased to partner with you, the World Health Organization, the Asia eHealth Information Network, and the German government on this important meeting and initiative. I'd also like to thank the team here in DHAKA for your dedication, hard work, and long hours, and I mean very long hours, to organize and put on this event. It's an honor to be in the company of all of you here in the audience. After many months of planning and laying out our strategic priorities for the Health Data Collaborative, it's great to see so much enthusiasm from our country partners and the momentum that's building as we embark on this work in countries around the world. I'd also like to thank our delegates from Nepal, Philippines, Cambodia, Bhutan, Indonesia, Myanmar, and our special guests from South Africa, who are here with us representing their country's commitment to build capacity for stronger national monitoring, learning, and evaluation. Thank you for spending the next 2 days with us and for sharing your perspectives, lessons, and knowledge. We are here to support you and encourage an open debate. This conference is about a new way of doing business. We, as your partners, are committed to working more strategically to align our resources and reduce duplication, so our investments and technical collaboration are more efficient, effective, and sustainable. I'd also like to emphasize that this has truly been a whole of U.S. government effort. I would like to thank my colleagues in the U.S. Department of State, Yoram Zaidi, and the Department of Health and Human Services, Maeve McCain, as well as Athalia Christie of the Centers for Disease Control for their commitment to this work. They unfortunately are not able to be with us here today, but they have been enormous champions and have helped us get to where we are. So I've been asked to talk about the Health Data Collaborative, its vision, objectives, and progress. This has truly been a team effort. I'd like to recognize the panelists and the moderator who have been intimately involved in standing up this new initiative. So I'm going to touch briefly on the Sustainable Development Agenda and implications for monitoring. It's a good place to start since the Measurement and Accountability Summit originated out of early discussions on the SDGs and served as the impetus for the Health Data Collaborative, which at its essence works to aid countries to track progress toward the health-related goals of the SDGs. So the 2030 Agenda for Sustainable Development now includes 17 goals, 179 targets, and 230 indicators. Goal 3 of the SDGs, ensure healthy lives and promote well-being for all at all ages, focuses exclusively on health, encompassing 13 targets on maternal, neonatal, and under 5 mortality, infectious disease, systems, and the emerging agenda of non-communicable diseases and injuries. Goals 2, 5, and 6, while not explicitly health-related, include many health-focused targets around areas such as family planning, nutrition, and water and sanitation. So coming in at 230 indicators, you can see this is a radically different agenda than the MDGs, which included only 48 indicators. Countries will have the primary responsibility for target setting, review, and follow-up, which will be voluntary and country-led and will take into account their technical capacity and resources, as well as the level of political support and will that exists within their governments. The global framework for monitoring Goal 3 will require a focus on progress toward universal health coverage, which is one of the 13 targets. There will be an explicit focus on equity, which will require data disaggregation by age, gender, socioeconomic status, and location. So an important implication of this new framework is that countries will have to track many more indicators with finer levels of disaggregation. It will require an increase in the level and efficiency of investments, which will be a challenge for many countries. But this is also an opportunity to strengthen country capacity to collect and use data. To do this will require much more active collaboration with programs within the health sector and partners aligning investments behind country health strategies and M&E plans. So in light of this new agenda, USAID, the World Bank, the World Health Organization, and the government of Bangladesh convened a summit on measurement and accountability in June of last year. The summit drew over 600 development partners and global health professionals representing 55 countries to collaboratively develop a new way forward to improve and sustain country health measurement systems for sustainable development. At the summit, participants endorsed the roadmap for health measurement and accountability and a 5-point call to action. I'm sure you have the 5-point call to action memorized, but just to reiterate, those 5 points are increase the level and efficiency of investments in health information systems, strengthen country capacity to gather, analyze, and use data, generate population health data, including civil registration and vital statistics, maximize effective use of technologies, and promote accountability, including global, country, and citizen input. The key takeaway from this summit was that there was overwhelming consensus for greater partner collaboration and joint action to align around measurement to meet country health priorities. So in response to this call to action, development partners, countries, and other stakeholders came together to form the Health Data Collaborative, which is now moving toward implementation. So here are some of the partners that attended the summit that are now part of this new initiative. It's a mix of countries, civil society, donor organizations, foundations, and academic institutions. So with the overall goal of strengthening country systems to monitor progress toward the health SDGs, the collaborative is about improving data quality and the capacity of countries to analyze and use this information to drive their own health programs, report on the SDGs, and improve long-term health outcomes. So using the 5-point call to action as the foundation, which is on the left-hand side of the screen, we have come up with 3 objectives and an overall approach that will help us achieve these goals over the next 15 years. These objectives include enhancing country-level capacity to monitor and review progress toward the health SDGs through better availability, analysis, and use of data, improving efficiency and alignment of investments in health data systems through collective action, and increasing the impact of global public goods on country health data systems through increased sharing, learning, and country engagement. So we made a lot of progress this year on the startup of this new initiative. The collaborative was launched in March at the UN Statistical Commission in New York, and the core team, which is housed at WHO in Geneva, was established. And this core team includes secondments from various partner organizations that are part of the collaborative. We've also formed a steering committee, which includes country members who have endorsed the operational plan. This year, we will identify 3 to 5 Pathfinder countries where some of the work has already begun, and I'll talk a little bit about that later in the presentation. And there will be a resolution at this year's World Health Assembly in May, supporting the collaborative as a key component of the global commitment to the Sustainable Development Agenda. So a little bit about, okay, so there's a lot more I can tell you about the collaborative, our priorities at the global level, how we're structured, but where I'd really like to spend some time is on the country work, where I think it's the most interesting. So engagement in countries should rely to the greatest extent possible on fostering country-initiated and led processes with broad-based stakeholder participation, where government takes the lead in design and implementation and sets up effective coordination mechanism for management of resources. As a principle, the collaborative is demand-driven. So our intervention in country is based on country requests. And countries that are right for the collaborative engagement are where there is potential to leverage collective action for aligned investments in support of country health sector and M&E strategies, meaning that there are partners on the ground that are willing to work together. Every country will be different, but a common theme is a strong national M&E plan as a basis for aligned investment. In turn, the partner countries will lead in the policy design and implementation, including strengthening effective mechanisms for management of resources and engagement between the government and partners. They will also extend engagement to outside of the health sector, for example, national statistics offices. We're also expecting an increase in domestic investment, and they will also do the follow-up and management of work plans and joint investment strategies. So to date, we've had 15 countries who have either expressed interest or have requested support from the collaborative. So our first country was Malawi, and in November of last year, the collaborative was asked by the Ministry of Health to come and for a joint visit and to support the process of integrating the collaborative's recommendations into the country's new M&E strategy. As a first step, a task force was created to oversee the establishment of a single platform to generate reliable information from all data sources. They reconfigured their district health information system, and they transferred control to the Ministry of Health, along with the employment of new communications tools. They've also have transferred program-specific data, has been integrated into a single data platform along with other program-specific data. And these concrete actions are enhancing local capacity to analyze and use information and to promote informed decision-making and laying a foundation on which to build. We had the opportunity last week to meet with some of our Malawian colleagues in Washington, and they noted that the demonstration of commitment of development partners to the Malawian M&E plan has helped accelerate progress and commitment to alignment with their partners on the ground. So our next stop will be Kenya. Kenya has been involved with this effort since the summit and has been selected as a Pathfinder country. The collaborative received a request from the Ministry of Health to provide a multi-partner technical assistance, including a joint mission in May. And Kenya's process is mostly country-driven with some technical assistance from partners. And they're also looking for high-level political support and technical assistance. The country is organizing and driving efforts, doing a lot of upfront work in advance of our involvement. They're already holding discussions and reaching agreement around alignment and better donor coordination. So Kenya has identified 4 objectives for the upcoming mission. They would like to raise the profile of the SDGs and the global effort to strengthen country-led platforms, information, and accountability among government officials, partners, and stakeholders. They would like to rally stakeholders towards supporting a common M&E framework, ensuring a clear plan on how long-term support to M&E coordination mechanism will be provided. They will agree on a roadmap for implementation of priority actions and gaining high-level commitments from partners for aligned support. They're going to agree on an operational plan for implementing some selected high-priority quick wins, which are listed here, and in the interest of time, I'm going to move on. But I do want to say that they're really going to hold, Kenya is planning on holding partners to account. After the commitments are made in May, they're going to have, as part of their health congress, which they have every November, they're going to ask partners to report out and on progress toward those commitments. So we will hear more about the remarkable progress of Bangladesh in the next session. But I do want to say that Bangladesh has generously convened this regional conference as a co-organizer of the Measurement Summit and a member of the steering group of the collaborative. And following the AHEN workshop last fall, this conference is an effort to further countries' progress in responding to the 5-point call to action. This conference is our first major activity in the Asia region. So on behalf of the Health Data Collaborative, we're here to recognize and support your efforts to achieve your health-related sustainable development goals through better data. Thank you very much.
Thank you, Kathleen. Before we head into questions and discussions, I would request my colleagues on the dais to also just reflect on what Kathleen just said, and then I'll open the floor. So maybe Alastair from WHO, if you can provide your comments.
Great. Well, thank you very much, Katie. I think in the spirit of the collaborative, we're not going to then do another presentation by WHO, another one by the bank. We very much support everything that's been said in that presentation, because this is about collaborative. And I'd just like to thank the organisers of this meeting, because it's such good timing. That the Health Data Collaborative is in evolution, and it requires all of you to help shape it. So this is your opportunity to feed into us so that we can actually develop a collaborative that truly is a collaborative. Before working for WHO, I worked for DFID, the Department for International Development, which is the UK government. And the UK government continually talks about value for money. It talks about effectiveness, efficiency, equity, and sustainability. And in my mind, the Health Data Collaborative is embracing that whole concept of value for money. What do I mean by that? Well, the first thing is about effectiveness. And the current interest in data is a great opportunity to improve the effectiveness of the health sector. It's about improving data-informed choice, something that all public health people in this audience know well, because that is the foundation of public health. But it's about investing also in strong monitoring and evaluation, such as has been done in Bangladesh, to support national and subnational planning, budgeting and prioritisation. This is an objective of the Health Data Collaborative. The Health Data Collaborative is also about alignment. And when I talk about alignment, I talk about the responsibility of technical and financial partners of aligning that support with strong national monitoring and evaluation. It's about avoiding the multiple demands for data and about the parallel disease programme monitoring. This is a great way to improve efficiency. Katie mentioned the SDGs. The SDGs is about leaving no one behind. If there's any one message of the SDGs, it is about leaving no one behind. Yet not everyone is currently counted, and there are important aspects of their health that are neglected and not measured. We need to do more on CRVS, civil registration, we need to do more on ensuring that everybody is counted and improve the availability of disaggregated data. This is necessary, in fact fundamental, if we want to achieve equity. And sustainability isn't about setting up a new global initiative. It's about establishing a meaningful legacy of statistical capacity and systems. Finally, a very short summary. This is not another global initiative. This is not a funding instrument. It's about a way of working. It requires strong government leadership. It requires inclusion of civil society. It's about alignment of technical and financial investments. And it's not going to be the panacea without being an effective way of finding its track by working with others, other initiatives, other collaboratives, and about learning as we go. And my last thing to you is you're here to shape it, and we will learn as much from you as you will learn from us. Thank you.
Thank you, Alastair. And I ask Sam Mills to provide the comments on the World Bank.
Yeah, thank you very much. On behalf of the World Bank Group, I'm pleased to be part of this inter-country conference on measurement and accountability for health in the Asia region. First, I want to take this single opportunity to personally thank Professor Azad for his leadership in organizing this conference. He was part of the steering committee that organized the summit that the World Bank hosted with USAID, WHO, and several other agencies. And he's also currently part of the steering group for the Health Data Collaborative. We also want to thank the Honorable Secretary of Health, Islam, who was also represented Bangladesh at the summit and was a co-sponsor of the summit. Bangladesh endorsed the roadmap and the 5-point call to action. They promised to organize a regional conference, and here we are today. Thank you very much. We really appreciate it. I also want to thank the co-sponsors for this conference, USAID, WHO, GIC. And thanks, Katie, for the excellent presentation. I don't have much to add to it. Just to say that the World Bank is fully supportive of this collaborative. As you may all be aware, during the MDG era, we had some challenges in monitoring some of the indicators. For instance, for MDG 5, countries needed to have complete and accurate civil registration and vital statistics to be able to produce the maternal mortality ratios. But most low and middle income countries had difficulty in generating these estimates. So what the UN agencies and the World Bank used to do was to use statistical models to generate these estimates. This was very useful in monitoring MDG 5, but then there were times when the estimates were generated, we have some countries disputing some of these estimates. The question then is, in the SDG area, are we going to continue doing the same, or we want to see some improvement? And I think that is where the collaborative comes in. One of the 5-point call to action emphasizes the strengthening of building institutional capacity in countries to be able to collect the requisite data, to be able to analyze the data, and then to disseminate and use the data for evidence-based decision making. It also calls for strengthening population level data, CRVS, household surveys, what have you. It also calls for strengthening of health facility and community information systems as well. Sometimes we often hear that financing is the major constraint. There may be some truth in that, but I don't think it's always true. There are resources in some countries already. I think the challenge has been that there is duplication of activities. And that is what usually, and then we sometimes have parallel reporting systems in countries. So I think these are some of the things that we need to handle as part of the collaborative. For the World Bank, we also acknowledge some of the data challenges during the MBG era. So our senior management actually put together a data council to see how best we can support countries in the next 15 years. So we developed an action plan, and we'll see how best. When my time is up, please tell me. So we developed an action plan as to how to support countries. And there were 3 areas that were prioritized, not only in health, but in the other sectors as well. We have CRVS, we are also supporting household survey, as well as price statistics. At the time that the Health Data Collaborative was launched last month, several international agencies and donors made some commitments. And for the World Bank, we made 5 initial commitments. The first was that we were going to provide some finances to 5 priority countries to strengthen the health information system. These countries include Cambodia, DRC, Kenya, Liberia, and Malawi. Katie has mentioned about Malawi. There was a mission there last November, and as part of the new health project that we are developing, which we approved in July, we hope to provide some financing for Malawi. In Kenya, Katie also mentioned Kenya, there would be a joint mission there next month. And I was there a couple of weeks ago. We've already started some discussions with the government as to how we can support them to strengthen the health information system, operationalize the MA framework, as well as CRDS. In Liberia, there was a joint mission with WHO as well last month, again to help strengthen the HMIS, MME, and then the CRDS. USAID has already helped the Ministry of Health in developing the HIS plan. So the groundwork has already been done, and the collaborative will only help to strengthen that. For DRC, again, I think the project was approved a month ago, so we are hoping that together we can support that as well. Cambodia was a country that came the very last minute. We haven't had much time to discuss that, but there will be some financial resources for them when it's approved next month. This is not to say that all countries will require some financial resources. For some countries, it may just require some technical assistance. And in others, it will merely changing the way we do business to ensure that we are fully aligned and avoid the duplication of activities. Now, how can countries implement the roadmap and the 5-point call to action? I think there are certain opportunities. For example, when you are developing a new health sector strategic plan, that is the opportunity to see how best you can incorporate a 5-point call to action. When you are doing the midterm review of your existing plan or your MME plan, that also presents another opportunity. And I think for all countries, since the SDG indicators has been finalized, it will present an opportunity for all countries to revise their existing plans to incorporate the SDG indicators as well. So I think there's opportunity for all countries actually to implement the 5-point call to action and the roadmap. The other commitments, I don't want to go into all that, the moderator is looking at me. So in a nutshell, I want to say that The World Bank is fully supportive of the collaborative, and we look forward to working with all of you in implementing this. Thank you.
Thank you, Sam. So I think we heard the perspective from members of the collaborative organizations. We heard about working together, alignment, harmonization. I would ask my colleague and friend Chams to give a perspective from an organization that is not, or not yet, part of the collaborative, but maybe talk about the experience of some of the factors that we mentioned as important for the collaborative. So Chams.
Thank you, Binod. I work at icddr, which stands for the International Center for Dialysis Research Founders. It's a long name. I head the General Charter Division there. We have been very active for the last over 50 years, in this country, helping, particularly working with government and partners in improving health conditions in this country. And what I'll say in the next few minutes is basically a look from on the collaborative and on the collaboration from outside, but it's not exactly from outside because we are very much part of what is happening in the country. But it is an attempt to look at it from a bit of a distance. About a year ago, May 2015, the country adopted the Monitoring and Evaluation Strategy and Action Plan. And it was a major move forward for the country in terms of the sector plans, with action plans being both short term and mid term. That did not happen in a vacuum, because for the last few years, a lot of work has been happening in terms of improving monitoring and evaluation in this country. There are many partners, a lot of investment is happening. So the key question that remains, given what the experience of the last 1 year is how does the strategy and action plan change the ongoing processes, or do the ongoing processes have a life of their own that somehow needs to be shepherded eventually? So I was in an every newborn action plan metrics meeting outside in London on developing some tools for improving measurements. And one of the things that was talked about there was the statement was made that Bangladesh was presented as the country as the largest user of DHIS2, which made me feel very good. But I think what was even more important was the fact that it was not just DHIS2. A lot more is happening beyond that. And I think that is what makes this country very exciting. But also makes it challenging. The key challenge is that there are various pieces by various partners, some big, some not so big. And how will all these pieces come together to make a whole? And I think, and the whole being what we have defined to be our objective in the strategy, overall strategy. I am optimistic, but cannot underestimate the challenges. The government has been playing a very strong role in shepherding this, but that has to continue. And as the number and the level of investments in the partners increase, that will be increasingly challenging. The key issue here, and I think which is why I mentioned whether to extend the strategy and action plan actually influence what the work that has happened in the last 1 year and the work in the future, is how are we handling the gaps and the duplications? And I think we do see quite a bit, because as we see, each of the activities that is happening tend to be more discrete implemented by an implementing partner. And sometimes we do not know exactly how they combine and contribute. And you overlay that with the structure in the government that we have. We have two different directorates, almost entirely two different MISs. How that itself creates a challenge in terms of how to link data between the directors, because some of the data have to be shared. And often you will see partners working with one director, not with other directors, and then and the work diverging, the results diverging. I'll give you a specific example of challenges that we see. Last year we had an external WHO evaluation of the post-PCV introduction, the PCV vaccine introduction in this country. And one of the observations made by the evaluation team was that they looked at the EPI's own information system, as well as they looked at what was being produced by DHS2, and they said that what was being produced by DHS2 did not seem to be as optimum as what was the information system that was run by EPA. So there is a challenge, and the challenge here is, so we have, at one side we have a multitude of partners, development partners, including ourselves, who are working with the government with our own discrete pieces, but we also have programs with their own systems, and then duplicate systems, and often these systems function to the level of effectiveness to the extent that they are being used by the programs. I will not, but I can cite examples of systems which are currently collecting data, processing data, but very rarely is the data being used by anybody, and that is a problem. So the objectives of the collaborative, which was started, a couple of months back, I think what it will help us as we move forward with this, and we start working together, it will help us in many ways. It will help us work together, but also we can draw on the collaborative in terms of technical help and solutions. We need some of that, a lot of that, even though much of the solutions that we are implementing in this country are largely homegrown solutions. The mechanisms for coordinations and collaborations, are there, but can be improved on, can be much more effective. And I think there are good ongoing challenges there. And my final thought is that, is that the investment that we see in Bangladesh is not only because all of us are starting, because it's not that we're all starting to understand the value and the need for M&E, but actually we're starting to appreciate that something can be done about it. We're starting to see results, and that itself drives the investment and the excitement in this country. And I think I will stop with that. Thank you.
Okay, thank you, Charles. I would like to open the floor take a few questions if there are, or experiences from other countries. Are there any questions that you would like to raise with the panelists? Or you would like to share any experiences? Mark.
All right, I just want to start off with a very simple, basic question regarding a way to interact with the collaborative. We heard the experience from Malawi and Kenya, starting off with a letter of request from the Ministry of Health to the collaborative. Who is the collaborative? Who does that letter get sent to? And I think we've had some discussions in this region in Mali about the collaborative itself, but now I think it would be helpful to understand what do ministries of health need to do to write a letter of request and who does it go to?
Excellent question. Yeah. Are there any more questions? Otherwise we'll go into answering that question first. And maybe you'll answer that.
Sure, thanks, Mark. So, great question. So, I mentioned in my talk is that the collaborative is being hosted at WHO in Geneva. So, one pathway would be for that country to work through their WHO office, and then to send the request, which would then go to WHO in Geneva. I do think there's the partners that are represented here, the bank, USAID. In addition to WHO and also Germany, you could also go through those partners as well, I would think. But ultimately, the request will go to the World Health Organization, and we will then take the lead to inform the partners of the request, and then we would take it from there. We're trying to keep this as simple and with as little bureaucracy as possible, but yeah, so I hope that answers your question. Maybe Alastair, would you like to add to that?
Yeah, just to build on that, because it's a really important point. The way that you can engage, as Katie points out, is through WHO, but through any of your partners. The challenge for us is then how we communicate effectively at that level of partners. But that's a fair challenge. We should be able to do that. One of our failures in the past is that we haven't been as effective at communicating as partners. So we will use the collaborative to improve that. But to answer the question, you can use any channel. You can use WHO, we welcome that channel because it's an existing channel, but it shouldn't deter you from using other channels, and then we then bring it to the collaborative, which, as I say, isn't an institution, it's something about improved ways of working between partners.
Yeah, thank you. I think that's it.
Yeah, to add to that, I think WHO is currently the secretariat, so perhaps it would be good to direct your questions to WHO. But every week we hold a conference call. We have weekly conference call where we update to one another. So whichever partner that you channel your request to, you might end up all getting to know about it and discuss how collectively we can provide some support. Thank you.
Thank you. Are there any other questions? I think we have a question from Bhutan.
Thank you. Actually, the question that was raised by Mr. Robb was very much relevant. Actually, I was also about to ask about the collaborative efforts. This is quite very diversified, whatever, but anyway, it was very clear. Now, my question would be like, Bhutan actually, like, we have health information system existed, but now we are trying to do it much more in a way that our information is very authentic, reliable. So what we are doing is like now, instead of top down, so we are doing from bottom up. That is attacking every individual. That means the patient to have a very good information. But in the process, we could see that there are a lot of constraints. Like we need to have resources. Now it is quite a relief for me that we can have a different approach to get to USAID and even World Bank. That's very relieving for me to say. Now, my question would be to the panelists or even Professor Azad. Like, I think we have heard about very good end of the story, but what about the other challenges, like especially the human factors? Like we could see that in Bhutan, like we wanted to implement, but we need a very strong collaborative efforts from the individual. So like maybe it will be good for us, like in the process of implementation, then in the proposal. So we could always incorporate such factors, human factors. Thank you.
Thank you very much for the intervention from Bhutan. Would you like to respond to that, Professor Azad? It was directed at you. Are there any comments on the question from Bhutan?
I'd like to make 2 comments. And the first is that I think your approach of seeing people, not just patients, but people as custodians of information in order to improve public health is essential. So a mother deciding whether to vaccinate her child, knowing about the safety and the effectiveness is critical. The whole of the SDG agenda is about how people are making choices to stay healthy and how we actually have that as part of our data revolution so everybody is informed is critically important. But with that there comes a huge number of challenges. And I think that the comment about capacity is critically important. And the Health Data Collaborative alone will not solve that problem. And it will not solve many of the problems unless there is really strong leadership of government that puts data at the centre, that builds statistical capacity and systems to get the job done. And just to say about the Health Data Collaborative, the Health Data Collaborative isn't unique. It's going to be one of a number of different collaboratives. So there'll be collaboratives looking at climate, there'll be collaboratives looking at gender, and how these collaboratives work together to all support and strengthen statistical capacity in systems is going to be critically important.
Professor Azad.
I think it is better to answer this, okay, otherwise we will forget. This is the most critical question. but I think this should not be looked as a barrier. The experience we see that, if we actually enter the data real time, that means we are working, producing data, we are writing the code. If there are devices, and we can actually directly write this data on the system. The problem is that, to do this, we don't need to hire additional human resources. This will be a huge burden. Rather, we can use the existing resources. The question is, we need to train them. This will not happen in a day, this will take time. But this can be done rapidly or quickly or in a short time. The policymakers, they should see the data. That is important. Because data will be entered maybe at the grassroots level. But if the policymakers see and they ask questions about the data, the people working at the grassroots level will be sincere, will be accountable. So we need to actually have more advocacy so that the policymakers, they become more interested about the use of the data. So that is the answer, and we don't need to hire people. Rather, we need to train the existing people to do the job.
Yeah, thank you. I think for the next today and tomorrow, I think this is an opportunity to actually exchange ideas, to learn from each other, and to pick up on ideas that other countries might share. So I think your question is very relevant. I think this is the time to actually learn from the experiences from other countries. Are there any more questions on the work of the collaborative? Yes.
First of all, I am very grateful that the Philippine Statistics Authority has been invited to this very important forum, and really duplications of efforts and data, as well as the availability of information at the subnational level, are among the challenges that we are facing now. And this health data